thanks. We're live on YouTube, and UGTV will be within the next 30 seconds. Live on UGTV.
Just give me a moment. I'm missing a page, the starting page of the guide. Thank you. Before I call the meeting to order, I want to announce that due to COVID-19, commissioners, staff, and the public are attending remotely via Zoom or by phone. All participants joining by phone should mute their phones when not speaking to avoid background noise. During the meeting, please make sure that you announce yourself by name and title every time you speak, so the public that is observing knows who is speaking. This is critical, given the number of remote participants and his current guidance from the Kansas Attorney General. I would ask the clerk to please call the roll.
Roll call. Ramirez.
Here.
Johnson.
Here.
Kane. Markley.
Here.
Walters.
Here.
Dilbrook.
Here.
Bynum.
Here.
Burrows.
Here.
Townsend.
Here.
McKiernan.
Here.
Alvey.
Here.
And Commissioner Kane, are you on?
Finally. Here.
Thank you.
Thank you. I would ask Commissioner Johnson, pastor of Faith Deliverance Church of God in Christ, to please lead us in prayer, and then we will pledge the allegiance.
Let us pray. Good and gracious God, we thank you for yet another opportunity for us to come together as the Commission for the Unified Government of Wyandotte County, Kansas City, Kansas. And as we pray tonight, Lord, we are continuing to be mindful of those families that have been bereaved from COVID-19. We are also mindful of our first responders, as well as the essential workers who are giving their lives day in and day out to make our life better, to keep us safe, and to fight against this deadly disease. We ask, oh God, that you would be with us in our meeting, Help us to remember always who we represent, and give us a mind, Lord, to work together in a spirit of cooperation and peace, we pray. In the name of our Christ, our Lord. Amen.
Amen.
Amen. I pledge allegiance to the
To
flag
the flag
of the
of
United
the United
States of America and to the
the
republic
for
for
which
which
it
it stands, one nation,
nation, under
under
God,
God,
indivisible,
with
with
liberty and
liberty and
justice
justice
for all.
for all.
Thank you again, Commissioner Johnson. Are there any revisions to tonight's agenda?
We do have one change. A new item has been added under the consent agenda. It will be item 4, which is a plat of Menards Lot 1, located at 18th Street and I-35. That is the only amendment.
Thank you. So the first order of business is the mayor's agenda. I'd ask Health Department Director Julianne Van Loo to announce the COVID-19 health orders.
Thank you, Mr. Mayor. Good evening, Commission. We have a brief presentation for you this evening, just a quick update of the data and where we are, and then an explanation of the health orders that go into effect early tomorrow morning. With me this evening is our Deputy Health Officer, Dr. Erin Corvo, and our Health Officer, Dr. Alan Greiner. A quick snapshot, as we typically do, of where our case rates are. Again, a reminder for the public that despite having fewer cases than surrounding jurisdictions and fewer deaths, when we look at it as a rate per 100,000 population, we remain significantly higher in both cases and deaths than the jurisdictions surround us. For our rolling 7-day averages, we are now up to about 100 cases a day. This is about a 3-fold increase from where we were 8 weeks or so ago, so a significant uptick for us, one that's putting a substantial burden on our testing and our contact tracing abilities. Our deaths currently for the past 7 days are at 0. However, I would caution an interpretation of that as anything positive. There are 2 caveats there. One, that deaths usually tick up a couple of weeks after a substantial surge, so I would expect to see additional deaths coming in coming weeks. And secondly, that we often don't receive news of deaths until weeks or months after they happen due to the process that happens with death certificates and the way they make their way through the state health department and back to us. So while that looks good, we are still bracing ourselves and anticipate an uptick there. Our percent positivity at a staggering 28.8%. Again, as a reminder, this is percent positivity for all testing that happens in Wyandotte County at the health department's Kmart site, as well as various other clinics and hospitals. So it is testing symptomatic and asymptomatic folks, and of those folks, 28.8% are testing positive over a 7-day average. So what we're really seeing here is substantial uncontrolled community spread of COVID-19. When we look at confirmed and probable cases by date, you can see here that we had that major spike over the summer, and then we were able to decrease over August and September. A lot of that was due to significant uptake in mask wearing after the mask order and a lot of compliance with those orders, which has been great. However, we've seen this, again, this drastic uptick in these last couple of weeks that's quickly becoming exponential. So we've watched Johnson County and Casey-Mo and Jackson County be a little further than us in terms of how quickly their case numbers are rising, but we are now starting, unfortunately, to follow suit. I'm gonna skip over that. I'm gonna go ahead and pass it to Dr. Corvo, who's gonna talk a little bit more about age range and the school situation.
Thank you, Julianne. Hi, everybody. This is Erin Corvo, again, the Deputy Health Officer for the Public Health Department. Just wanted to continue showing some of the data here. We often get questions about, who is actually infected. And in Wyandotte County, you can see that the rates of infections that have been detected are really actually in our younger population. Of course, we're not seeing that our 20 and 30-year-olds are dying most often, which is a good thing. But we do think that our younger population is actually contributing to the spread of the disease quite a bit. Next slide, please. Wanted to cover a little bit of data also associated with our schools and the cases that we're finding there. You can see the school district there to the left. And then the next column over is the number of student cases during the semester. Now, of course, our KCK public schools have not been in session to date. They've been doing completely remote learning, but Turner, Bonner, and Piper have been in school, at least partially in school, and some remote learning as well. We've had really continued a great relationship with our schools, with our superintendents, with our school nurses and teachers. And so just to assure you that we've been in very close touch with them throughout this pandemic. The next column over here is number of staff cases. And then the next column over is the number of cases since November 1st. I really just wanted to point out that, of course, Turner closed November 3rd, so we're not seeing so many cases, but 13 cases in just a couple days. But Bonner, Edwardsville, 18 cases out of their 23 were since November 1st. So obviously we can see that since November 1st, we're seeing a real uptick in that community spread, just as Julianne alluded to. Next slide, please. I do also want to say again that our hospital capacity is unfortunately still a major concern. Our local hospitals, we've been keeping up with them. Of course, there's been a lot of news regarding need for more beds and especially more staff. We've seen that this is a continued problem, not just here in Wyandotte County, but in the metro in general and all over rural Kansas. Dr. Greiner and I regularly attend calls with the health officers and various physicians in other communities around. And this is a very regional problem and of course is happening in other states as well. Yes, I do want to also point out that with the flu season coming, we're really very concerned. And so we think that, remember, please get your flu shot and such. We don't want to see hospitalizations for flu on top of COVID-19. I just don't think our hospitals could take it. Now I want to turn it over to Dr. Greiner to finish up our presentation this evening.
Thank you, Dr. Corvo, and good evening, commissioners. So we've been trying to put out information about Thanksgiving and the fears we have about the risk of transmission over the holiday. We've tried to emphasize that people gathering indoors is just a bad idea at this point in time. We understand that Thanksgiving is really about family and gathering and giving thanks, but we think this year people really need to consider strongly staying with those that they live in the same household with and not intermingling with others from other households. We recommend against travel. And if people do gather or if people do travel, of course, some states require you to have a negative test prior to traveling. But if people are going to be doing any gathering and they find themselves in that circumstance, we believe getting a test and proving that you're negative is probably something that's a responsible thing to do, although not as responsible as just staying with your own household family. Next slide. So our new health order that goes into effect at midnight tonight was the result of really intensive effort with the Core 4, as well as a couple other jurisdictions in the metro area over the past 10 to 14 days to really try to get the best input from all the health officers and health department administrators, and also to work with the elected officials to try and achieve some unity on what made sense to try and slow this really big level of community transmission down. So what we are going with at this point is to move to having 50% capacity or occupancy load in most settings where larger numbers of individuals are there. We think business can continue as usual. And in our order, it does talk some about how people mostly have incidental contact in businesses and how restaurants and bars have done a good job of socially distancing their patrons. And so we think that can continue, but we just don't want situations where people cannot maintain that 6 foot of social distancing. We have a restaurant and bar curfew at 10 p.m. We understand that this is hard for these businesses, and a difficult circumstance. But again, this was kind of the consensus view of the Metro. Now, Johnson County went with a slightly different time frame for their curfew, but we really think that there is high risk of transmission in these settings, and the later it gets, and the more beverages people have had, the more they're going to be talking loud or possibly not distancing as well as they would otherwise. And again, we realize this is tough, but we think it's the right thing to do. We also have a gathering limit of 10 people or less. So if people cannot conduct business in a setting where it's incidental and limited terms, close contact, we just don't think anything should have 10 people there. So if it can't be guaranteed, if that social distancing can't be guaranteed, we don't think it should happen, and we want people to adhere to that 10-person or less limit. Now, if there's questions, we realize there's a little bit of gray area between what 50% occupancy can be with guaranteed social distancing versus gatherings of 10 persons or less. We have on the website a link where people can click and submit a plan to us, or put in a plan and ask questions, and we'll interact with them from the health department to try and guide what they do and make sure it's safe. And I think that's all we have here from the Public Health Department.
Commissioner Townsend.
Thank you, Mayor. Good evening. I just wanted to make two comments. One was to commend all of the members of our health department for the content of the ads that I've seen recently playing on television. One has to do with a young man, and you see really two versions of him. He appears to be in that age demographic that Dr. Corvo talked about, in that, 20 to 30 something. And the prudent one says he's going to get a COVID test once he's been advised by a friend that the friend tested positive, and he stays home. The other version of him elects to go out and see his mother and some other friends, and then he gets a text or some communication from his dad telling him to contact his mom because mom is not feeling well yet. I think that says a lot in not a preachy way. And the other one, at least the version I saw, had to do with a particular demographic, and it talked about the population percentage of African Americans in Wyandotte County, which I believe was about 23%, compared to the statistic, I believe it was 39% of all of the cases so far in Wyandotte County are by being played by African Americans. So I appreciated the content of those commercials. There may be others. I have not looked at the Spanish language channel to see if there are similar ones being played. But when I hear, what is Wyandotte County doing? Why aren't we on TV? These are two great examples of the use of the television media for that. So I want to commend you for that. One last thing with regard to this particular health order, could you talk about the impact, if at all, on church gatherings? Again, thank you for what you all are doing.
Yes. Thank you, Commissioner Johnson. We have in this order asked that weddings and funerals adhere to the 10-person or less gatherings, but we've been advised by Ken Moore and the legal team that we should not have anything specific regarding any of this order affecting faith-based or religious organizations. Now, we still have strong recommendations that in those settings, people social distance and do it extremely carefully, and that people don't sing and that people wear masks. But we've been informed that probably that's an area legally we shouldn't have the order apply to. So that's the current situation.
Okay, thank you. You're going to make me put my picture up so you don't confuse me with Commissioner Johnson. I guess I haven't seen you long enough.
I'm sorry. I apologize.
That's your Christmas gift. Don't abuse it. Thank you again.
Commissioner Ramirez.
Thank you, Mr. Mayor. As always, I want to thank Julianne, Dr. Greiner, Dr. Corvo for everything that they are doing, our health department, all the staff. This is a virus that changes our aspects of life almost daily. And so I can't thank you enough for all that you do. It doesn't go unnoticed. I've spoken to some constituents, and they say they're very happy with the response that that the county has taken, and that, again, as I always repeat when I have conversations with the health department, is nothing is political. It is all based on data and the health and well-being of our community. And so I thank you for that. And I hope that we can continue to open lines of communication with all elected bodies in our county. And so thank you for everything that you do and that you will continue.
And thank you. And I would just like to say, I think a special commendation really needs to go to the health department, but also to our schools that have worked diligently with the health department to try and find ways to be able to provide for in-person instruction. And that, again, to be clear, when these cases show up, it's not being transmitted within the schools so much as because of the protocols we're following, but it's really coming when we go home, the kids come home and we bring it in and they take it, they get it and they take it, but it's not happening within the schools. It's happening in the community. And just to continue, I keep asking people for this holiday season, if we would just each one take personal responsibility and neither get nor give the virus. Commissioner Kane? You're still muted, Commissioner.
Did that work?
Yes, sir.
Okay. Well, I agree with Christian about, I would like to see us meet with the school boards and the other elected bodies with the health department, so we know what they're saying to the schools, and then we know how the schools feel, and maybe we could jointly come up with something. But I think it's important that we're hearing the health department side, and we're getting secondhand what the school districts are saying. So that's just something that I think we should do.
Okay, I see no more hands. Thank you so much for the update. That, Nate, takes us to the consent agenda. Does any member of the commission or the county administrator wish to set aside any item on the consent agenda? If an item is not set aside, all items on the consent agenda will be voted on by one vote.
Commissioner McKiernan, move to approve all as submitted.
Ramirez, second.
We have a motion and a second. Roll call, please.
Roll call, Ramirez,
Aye.
Johnson,
Aye.
Kane,
Aye.
Markley,
Aye.
Walters,
Aye.
Dilbrick,
Aye.
Bynum,
Aye.
Burrows,
Aye.
Townsend,
Aye.
McKiernan.
Aye.
Motion carries 10-0.
Thank you. We're now at the public hearing agenda. First, an amendment to the 2019 annual action plan to incorporate CARES Act allocations. I'd ask staff to make some opening remarks.
Thank you, Mayor.
Sure.
This is Wilbur. Oh, sorry, Doug, go ahead.
Go ahead, Welby, you're good.
This is Wilbur Miller, the Director of Community Development. The department has received an additional allocation, a second special allocation of community development block grants from HUD through the Corona Act, the Coronavirus Aid Recovery and Economic Security Act, or CARES Act. we have received an additional $788,000, making our total allocation of community development dollars over $2.1 million. In order to receive these funds, we must submit a second substantial amendment to our 2019 annual action plan, which incorporates those new dollars. We also have to hold a public hearing that we're handling tonight and give the public time to comment. And after the public hearing, we ask that you approve the resolution for the substantial amendment to be submitted to HUD. Stephanie Stauffer, program coordinator of my staff, will be making a presentation about the substantial amendment. Thank you. Stephanie?
Okay, sorry, I was having trouble with the mute button. Thank you, Olga, for the introduction. Good evening, Mayor, Commissioners, County Administrator, and participants. As Olga said, I'm Stephanie. We're here because we are making an amendment to our 2019 annual action plan to incorporate the CARES Act dollars. All the regular CDBG requirements apply to these funds, with the additional stipulation that the activities must prepare for and respond to COVID-19, the impacts of the health crisis. Of course, these requirements include meeting the objective that these funds have to be used predominantly for the benefit of low and moderate income households, which is defined by HUD as less than 80% of the area median income. We do have to spend 80% of these funds within 3 years, but the total performance period for the grant is 6. So this is a summary of our proposed budget. As you can see, we're spending a lot of the funds on public services. Typically, this is capped at 15%, but for the CDBG-CV funds, that's been waived. And so we've identified 3 public services. The first one I'm going to talk about is rent and mortgage assistance. The maximum assistance would be one-time assistance for up to 6 consecutive months for income-eligible households. And then, so we set aside $750,000 for this use. You can see the HUD income limits here on the slide. So it's family size relative to the annual household income. We're really hoping that preventing eviction is a big step in preventing the spread of COVID-19 by decreasing the likelihood that families will double up with another household, enter a congregate shelter, or shelter on the streets with limited access to hygiene. We're planning to utilize sub-recipients to administer this program. Second, we're wanting to fund food and meal programs to address some of the food insecurity that we're seeing with COVID-19. There's been an increased need, so we're thinking we could put $100,000 towards that. And also we'll use sub-recipients that are embedded in low and moderate income neighborhoods. The third public service activity we're looking to fund is YCO Connect, and this is going to be a collaborative effort with the health department to embed community health workers and community level organizations to help the most vulnerable populations navigate COVID-19 testing and care, and eventually vaccination. Community health workers, or CHWs, also provide health education, connect families to other COVID-19 resources, such as housing, food, and employment, et cetera. Community development will partner with the health department and other subrecipients to manage this project. The project would also involve employing Wyandotte County residents in the CHW roles at a time when unemployment is high. You may remember that this program came forward as an application to the CARES Act funding that came from the state through the Treasury. But due to the limitations, specifically the time constraints of those funds, they decided that that wasn't a good avenue, but through conversations, we think that CDBG-CV could be a good use for this program. And then finally, we always have to address administration and planning with CDBG. So the remaining funds will go towards this. Administrative costs are capped by CDBG regulation at 20% of the total allocation, which is a little over $400,000, but we're not planning to spend that much. And so here is a list of all of the administrative costs. So if you want to look through those, you can. Finally, I would just like to provide a reminder that CDBG-CV does have its own barriers and challenges. So as this funding and new program has been rolled out, some of the guidance has been slow. And so we're still waiting on some technical assistance to be released. This program can be cumbersome to administer, so we have to be really careful when choosing subrecipients to make sure they have the capacity to actually carry out the programs. There will be some additional reporting and documentation burden with this grant, such as extra quarterly reports and duplication of benefits, which we have to watch for. And then as a reminder, with HUD, there's no ask forgiveness later. Any money that's spent incorrectly could require repayment from the general fund. And so here's the budget again, and that concludes our presentation.
Thank you. I will now open the public hearing. Is there anyone present who would like to speak in favor of this item? Any hands, Rocky?
There are no hands raised, Mayor.
Right. Did we receive any notification from the public?
No comments were received.
Is there anyone who'd like to speak in opposition?
There are no hands raised, Mayor.
And did we receive any notification?
None were received.
All right. I will now close the public hearing and ask members of the commission have any questions or comments.
Commissioner Mike Kane, move for approval.
Well, Commissioner Townsend would like to ask a question.
Thank you, Mayor. Thank you, Ms. Stauffer, for the presentation. Ms. Miller, I did have a question about the rent mortgage assistance, which I think is an excellent use of this additional money. But if someone listening tonight had a question about how they might be able to get assistance, would they go directly to Ms. Miller's office or to one of these wraparound agencies, or and if so, what agency would they contact?
Commissioner Townsend, this is Wilma Miller again. We will be choosing a subrecipient to receive these, a nonprofit agency that already does rental assistance. Right now, a lot of them are dealing with the emergency solutions grant funds that we got. As you recall, we've received 2 allocations of that, totaling over $2 million also. We went through a RFP process and awarded both allocations, and I know they're still working on allocation number 1. They still have allocation number 2 to go through. Plus, we have our regular annual emergency solutions grant fund. HUD, I thought, was really good about giving us a long period of time to spend the CDBG dollars. So once we go through the ESG monies, we'll still have the availability to use CDBG dollars. Between now and then, we plan to, learn from the lessons of what's going on and seeing, who has done a really good job, and maybe we can do another RFP, or maybe we can find one agency who'd like to be responsible for it. So we really haven't selected anyone yet.
And if some constituent had an immediate need, though, knowing these funds, I guess, are coming, and it sounds as though there were already funds in the pipeline set for this, could they contact your office and be directed to this sub-recipient for assistance?
We recommend that they still call 211. United Way is still fielding those calls. And not only are they aware of the funding that we have given out, but they're also aware of other funding that nonprofits have in the KCK area. And I believe they also receive some money through the Unified Government CARES Act fund.
All right. So the best thing to do is, I'm sorry.
Yep.
The best
That's
thing
okay.
to do is direct them to United Way at this point.
211, yes, ma'am.
All right. Thank you very much.
You're welcome.
Commissioner Bynum?
Thank you. So just to clarify, this is money that's separate from and in addition to the CARES Act funding that our Unified Government Commission allocated to the various nonprofits, and including the United Way that Wilma Miller just spoke of. So the CARES Act money that we allocated is out in the community now, helping people with these kinds of things. And strikes me that this is nice because it can come along behind it, so to speak, and continue to help keep folks whole that are struggling. And Wilba, I think we heard that although you've not had a lot of direction from HUD, do you know yet of a timeline by which these funds would need to be spent? And that's it.
Commissioner Bynum, again, it's Wilba Miller. Yes, the unified government allocated funds, and then our department who received the funding from HUD has already allocated and awarded and have contracts with Emergency Solutions Grant. So there are lots of dollars out there to help right now. Those dollars, what we call the ESG COVID dollars, have to be spent within 2 years. And the community development dollars have to be spent within 6 years. But again, as Stephanie said, I think we have to spend 80% within 3 years. So
well, it's helpful to know that because, you know, the CARES Act money has to be spent by the end of this year, and that's a much tighter time frame. So it's really helpful to know the time frame on this. So thank you, Wilba.
I also like to say that the awards for the Emergency Solutions Grant are on our community development website under the CARES Act COVID-19 category. The amounts and who they were funded to.
Commissioner McKiernan.
Thank you, Mayor. I'd like to second Commissioner Kane's motion to approve as submitted.
Thank you. We have a motion and a second. Roll call, please.
Roll call. Ramirez,
Aye.
Johnson,
Aye.
Kane,
Aye.
Markley,
Aye.
Walters,
Aye.
Philbrook,
Aye.
Bynum,
Aye.
Burrows,
Aye.
Townsend,
Aye.
McKiernan.
Aye.
Motion carries 10-0.
Thank you.
Thank you.
We're at the standing committee agenda, the complete streets policy proposed. This item was presented to the Public Works and Safety Standing Committee on October 26th. Public comment was received at that meeting. The committee voted unanimously to approve and forward to full commission for presentation and approval. Commissioner Bynum, you chaired the meeting. You have anything to add?
Mayor, thank you. We'll have a nice presentation from Gunnar Hand. I believe we've had some receipt of letters of support for complete streets ordinance. State and federal policies both already have complete streets within them. The only other thing I would add at this time before Mr. Hand speaks is the fact that we will, with a policy like this, we will always be mindful of budgets. We will always be mindful of financial constraints that could be, you know, in play that might keep a complete street project from being able to be fully implemented. So it is not binding on us. It's all still in our hands to determine what we can afford and what we cannot, but it's certainly a good policy move forward. So with that, I'll turn it back. Thank you.
Thank you. Mr. Hand.
Thank you, Mr. Mayor, Commissioners. Good evening, and again, thank you for your time tonight as we give this presentation about the proposed Complete Streets Ordinance in front of you. This ordinance is a collaboration with many folks, which we'll go over a little bit later in the next few slides, but most directly, as it is within our Section 32, it is a direct partnership with the Department of both Planning and Urban Design and Public Works. So I'll allow my colleague to introduce himself. We'll kind of be passing the mic back and forth as we go through these only 17 slides.
Yeah, as Gunnar said, Troy Shaw, I'm the county engineer, and I will be presenting this with Gunnar.
So again, for those of you who are at the members of the standing committee, you'll basically be seeing the same presentation as we did before with a few small tweaks. We wanted to give a little bit of a background about what Complete Streets is, and then we'll talk specifically about the ordinance and some of its details, and happy to take questions at the end from everyone. So Complete Streets is pretty simple. It's a concept that basically prioritizes people over automobiles. Over the last 50 years plus in the United States, we've been building our public right-of-ways to move cars faster. And this Complete Streets movement, which is national really, has been working to address the underlying policies that allow that. And so it's pretty straightforward. It focuses on safety, flexibility, inclusivity, and equity.
So as you can see, these are some of the features we talk about when we talk about complete streets. When we say complete streets, a lot of people just think of you're going to go put a bike lane on every street. But as Gunnar mentioned, complete streets are designing streets for people, not just for motorists. So it's all types of people, including motorists. Next one. So here are a couple real world examples of what this would look like in different alternatives. There in the top left is kind of a temporary solution you could do without infrastructure. And one of the unique things about these, you can see our 3D crosswalk at the bottom right too. I like that Gunnar added that. So one of the unique things about adding stuff like this is it gives us the opportunity to add green infrastructure to things like this too, and also utilize that to help with stormwater improvements at the same time as you're helping with traffic safety as well.
And we mentioned that this has been a collaboration across the community. I think it's important to recognize that really the movement for a complete streets ordinance began when this body approved the Complete Streets resolution back in 2011. There have been multiple community members and others who have been working on this since that time. But in the more concerted effort in the last few months, really the summer into the fall, as we've been drafting this particular ordinance, we put out a survey and got about over 100 plus, about 109 responses from the community. As the commissioner mentioned, I think we've received 13, maybe 14 letters of support. And a lot of the folks who spoke at the standing committee in support are also here tonight as attendees. So I just wanted to recognize them as well. And a lot of this conversation has been happening inside of the existing mechanism within the UG, which is the Department of Public Health's Infrastructure Action Team. But this is also very much a response to the three emergency ordinances that you all passed this last summer. If you recall, many of those ordinances focused on opening up the public realm for both recreation and businesses in a safe way, in a COVID-19 socially distant way. And so we felt it was important to follow that up with an ordinance that really focused on the public safety and public health within the public right of way. And as you read some of these bullet points, I think what I would just say is, again, going back to the sort of trend over the last 50 years, as we've been designing and building roadways to move cars faster, that has had a direct correlation in both traffic fatalities. As cars move faster, the rate at which you die from a traffic incident increases exponentially as you move up in speed limits, but it also has a much larger public health impact that we're talking within as well.
So we've kind of mentioned it, but the main focus of this policy is moving forward. The unified government will plan, design, construct, operate, and maintain the public realm for all users of all abilities. This is nothing new for Public Works. This is how we design projects now. It's just codifying what we're already doing. And another thing that's important to note is the reason I say we're already doing it is the commission has a strategic plan, and some of the goals for that strategic plan strictly relate to a complete street design. We've highlighted 4 here, but I could argue that all of them in one way or another are related back to a complete street design.
There's also much larger economic benefits to the implementation of different complete streets design elements at various levels. Namely, as we increase transportation choice, we can reduce transportation costs for households. If we create a city where you don't need 2 or 3 cars, you save all that money on payments, insurance, maintenance, gas, so on and so forth. But maybe even broader than that, there are plenty of studies that have come out in the last decade or so that have specifically talked about the economic impact of walkable communities. Walkable communities are more livable communities. they're more desired communities, and over time they create a greater value.
And this will get back to Commissioner Bynum's point in the beginning, but we were talking about budget, and anybody that's heard me talk about maintenance needs at any of the public works standing committees is well aware that my main focus is maintenance and getting budget for maintenance. So that was one of the big topics that I looked at when reviewing this policy. I am confident that this will not impact our maintenance abilities as far as pavement preservation, stormwater, or storm or sanitary sewer repairs. The way this policy is written, it gives us the ability to do those, or keep that maintenance going the way it is, and not impact that budget. However, there are benefits to complete streets. There's an ability to right size our streets. If we have our street or infrastructure overbuilt, this gives us the opportunity to reduce that, which could reduce lane miles of road for maintenance into the future. It won't be an immediate impact, but it could be a long-term impact to help our maintenance budget. And one of the other things that we talk about is as everybody here knows, Wyandotte County is a very diverse county. Downtown is not the same as Piper, which is not the same as Turner. Everywhere is different. And this policy does not tell us we have to do X, Y, or Z at any certain location. It gives us the flexibility to do what's right for the community in each area of the city, which I think is incredibly important. So, noting budget and other issues or other concerns that we may have, this policy also gives us the ability to not do complete streets if it's determined to not be in the best interest of the unified government or the citizens of the unified government. And I think that's a big driver to this, and we still, it keeps the commissioners and the city in general from getting boxed into a corner.
Another important part written into the ordinance is a certain level of accountability to sort of manage as well as track the success of the implementation of the Complete Streets Ordinance. We felt because the right collection of community groups and UG departments were already, in a way, having this conversation at the Infrastructure Action Team, that is why we named the IAT in the committee, in the ordinance, to sort of host these conversations. In no way does this mean that the IAT has to approve anything moving forward. It's simply a clearinghouse, if you will, where we can bring different projects, whether it's a countywide mobility plan or master plan, or potentially a street design, to this group and get a pretty diverse review and perspectives on certain projects or planning processes that are ongoing within the UG. And I think the other thing that Troy mentioned earlier, that this doesn't have any standards built within it, and we think that's important because we're about to embark on a countywide mobility plan starting as soon as early next year, where we can start to have these more focused conversations about, hypothetically, if we were to approve the policy tonight, how do we do that in different areas? How should we prioritize those projects? And what does complete streets mean for the UG? And so that's where we can start to get into the nitty gritty of the application of this broader long range policy. So I think in conclusion, there's a couple of things that we said that we feel are important to say again. We've developed this ordinance in collaboration and partnership with the community. We believe strongly that it is a continuation of something that's already been approved by this commission and Board of Commissioners in 2011. Commissioner Bynum mentioned it is already the policy of the state and the federal government and their funding agencies who give us funds for these types of transportation projects. These are the best practices of planners and engineers across our country today. And it's something that we try to put into practice already. And you've seen that in some of the projects that have happened over the last few months and few years. And so with that, we're happy to take any questions that you may have.
Thank you. Well, I see no questions. I'd entertain a motion.
Move to approve Ramirez.
Bynum, second.
We have a motion and a second. Roll call, please.
Roll call. Ramirez,
Aye.
Johnson,
Aye.
Kane,
Aye.
Markley.
Aye.
Walters,
Aye.
Philbrook,
Aye.
Bynum,
Aye.
Burrows,
Aye.
Townsend,
Aye.
McKiernan.
Aye.
Motion carries 10-0.
Thank you.
Thank you. We now go to, we have 4 items under the administrator's agenda. Item number 1 is the issuance of industrial revenue bonds, Series 2020A for the PQ Corporation. Mr. Bach?
Thank you, Mayor. PQ Corporation is one we've seen before us many different times over the years as a company that's been here well and around 100 years in our community. They've used the IRB formula to come in and do expansion and growth. I think one thing about it is we see them demonstrate that they continue to stay here, and while this provides them a temporary relief, some new incentives, it provides them incentive to do that growth. I will let Catherine Carter, our Director of Economic Development, explain what this project is. Catherine?
Thank you, Doug. Catherine Carter, Director of Economic Development. So this is a project that was approved by the full commission on December 31st. Not December 31st, on November 21st of 2019, so almost exactly a year ago today. This is a project that when it is complete will be about $100 million. These 2 series that you are referring to today, one is for 18 million and the other is for 2 million. So really what we do is we kind of phase, kind of as they build, we're able to kind of issue bonds so that they're able to get a full benefit of the 75% abatement that was approved back with the resolution of intent a year ago. So with this project, again, this is the first 2 phases. They purchase additional land and are building more buildings right at 1700 Kansas Avenue. So we're happy that this project is moving forward and they've started their building. They have to expend all $100 million by December 31st of 2027. Are there any questions?
Thank you. Commissioner McKiernan?
Thank you, Mr. Mayor. It is hard to believe it has been a year since we last considered this. And I'll just say tonight, as I said then, I am thrilled to have PQ in our community for well over 100 years as an employer and a taxpayer. And if it was appropriate, Mr. Mayor, I would move to approve as submitted.
Johnson, second.
We do have a question from Mr. Ramirez.
Yes, thank you, Mr. Mayor. I remember this item. I was commissioner-elect at the time when this came through commission, and I was there physically at the meeting when this was brought to us. I know there was some angst among some community members that were there at the meeting. I just want to reiterate, and Catherine, you can correct me if I'm wrong. Mm-hmm. The IRBs for this expansion is for new property that they're expanding to. The current property that they own, they will still be paying their property taxes, but the new expansion is what's being abated. Correct?
Commissioner Ramirez, you are exactly correct. Yep, thank you for that clarification.
Okay, I know, because like I said, I remember being there at the commission meeting and there was some angst among community members. So I just wanted to clarify that. And just in general, thank PQ Corporation for investing in our community and being a business that is willing to continue to invest. So, and then since I will stop so that we can continue with the vote.
We have a motion and a second. Roll call, please.
Roll call. Ramirez,
Aye.
Johnson,
Aye.
Kane,
Aye.
Markley,
Aye.
Walters,
Aye.
Philbrook,
Aye.
Bynum,
Aye.
Burrows,
Aye.
Townsend,
Aye.
McKiernan.
Aye.
Motion carries 10-0.
Thank you. Item number 3, issuance of industrial revenue bonds for the NP Turner Industrial Project. Mr. Bach?
Mayor, I'm sorry, I believe we have 2 ordinances we need 2 votes on. So I need a second vote on ordinance number, for the second one, for the $2 million bond issue for PQ.
Oh, yes.
Commissioner McKiernan, move to approve Series 2020B bonds for PQ Corporation as submitted.
Commissioner
Second,
McKean, second.
We have a motion by McKiernan, a second by Kane. Roll call, please.
Roll call, Ramirez,
Aye.
Johnson,
Aye.
Kane,
Aye.
Markley,
Aye.
Walters,
Aye.
Philbrook,
Aye.
Bynum,
Aye.
Burrows,
Aye.
Townsend,
Aye.
McKiernan.
Aye.
Motion carries 10-0.
Thank you. Issuance of industrial revenue bonds for the NP Turner Industrial Project. Mr. Bach?
Mayor, this is for the project that we see developing along the highway out where we just opened up the new Turner Diagonal. It was part of the intent of that we would have IRB projects. So as those buildings come up, there would be a associated IRB with each one. Ms. Carter, anything that you'd like to add to that?
Yeah, the only thing I would add is that for the entirety of this project, we're looking at about $155 million worth of building. What is being considered tonight is the bond issuance for the first building. So that's about $28 million, as you can see. And I think they're already getting ready and grading for buildings 2 and 3. So they are building fast and furiously, which is great because the faster they build, then the faster we end up getting a lot of great taxes and jobs. So this is a project that was approved by Commission June 13th of 2019, and they will need to expend all $155 million for the full benefit by December 31st of 2029.
This is Commissioner Philbrook. Move to approve the North Point Turner IRB Series 2020.
Ramirez, second.
Thank you. We have a motion and a second. Roll call, please.
Roll call, Ramirez,
Aye.
Johnson,
Aye.
Kane,
Aye.
Markley,
Aye.
Walters,
Aye.
Philbrook,
Aye.
Bynum,
Aye.
Burrows,
Aye.
Townsend,
Aye.
McKiernan.
Aye.
Motion carries 10-0.
Thank you. Item number 4 is a resolution relating to the Village West Apartments 2 project. Mr. Bach?
Thank you, Mayor. I will just go directly to Ms. Carter on this one to explain this assignment and assumption for this project.
Thank you. Catherine Carter, Director of Economic Development. This is an assignment and assumption very similar to the ones that this body has considered in the past. This is for that second phase of apartments out in the Legends, originally built by North Point, then they were sold, and now they are being sold for a second time, this time to Avanti Residential. There were IRBs issued in the amount of $34 million for this project. So really what this assignment and assumption is saying is that the new owner agrees to everything that was put forth in the original development agreement and bond issuance documents.
And as a reminder, I might add that while we did IRBs on this, as she noted the amount, it was an IRB calculated for the entire value. So they would be making a payment in lieu of tax for full value of property taxes each year. So there was no question about the amount that would be paid.
I'd entertain a motion.
McKiernan, move to approve as submitted.
Second, Philbrook.
We have a motion and a second. Roll call, please.
Roll call, Ramirez,
Aye.
Johnson,
Aye.
Kane,
Aye.
Markley,
Aye.
Walters,
Aye.
Philbrook,
Aye.
Bynum,
Aye.
Burrows,
Aye.
Townsend,
Aye.
Commissioner, thank you, McKiernan.
Aye.
Motion carries 10-0.
Thank you. That concludes the portion of our regular meeting. We are adjourned in that capacity. Now call back to order as the Land Bank Board of Trustees.
Mayor, I'm sorry.
Yes,
Did we handle the blue sheet item?
I think that was under consent agenda, was it not?
Yes, it was under the consent agenda as item number 4.
My apologies, sir.
Nope, it's okay. Does any member of the commission or county administrator wish to set aside any item on the Land Bank consent agenda?
McKiernan moved to approve all as submitted.
Ramirez, second.
We have a motion and a second. Roll call, please.
Roll call, Ramirez,
Aye.
Johnson,
Aye.
Kane,
Aye.
Markley,
Aye.
Walters,
Aye.
Philbrook,
Aye.
Bynum,
Aye.
Burrows,
Aye.
Townsend,
Aye.
McKiernan.
Aye.
Motion carries 10-0.
Thank you. That concludes our meeting for the evening. Thank you for your attendance. We are adjourned, and I encourage everyone, neither get nor give the virus.